Shall we start?
Yeah.
Good evening, everybody. On behalf of the IDF Southeast Asia region, it's my pleasure to welcome all of you for this webinar where we'll be updating you on the latest from the IDF 2025, ADA 2025 for our IDF audience. This is spread across many countries, India, Bangladesh, Nepal, Sri Lanka, Maldives, and perhaps Mauritius also. And I welcome all of you this Saturday evening and thank you all for joining us this evening. To set the ball rolling, I would invite my senior co-chair, Dr. Anil Boraska from Mumbai, to introduce the speaker and we'll start the proceedings. Over to you, Dr. Boraska.
Thank you, Malika. I'm so happy that Bansi has included me in this program. I'm also very happy to know that the real hardworking stalwarts from Southeast Asia are there. And it's my great pleasure to introduce Dina, who comes from Nepal, a great country, a great neighbor of India. And we have a lot of patients coming from Nepal, and her surname is very familiar. There was a very big singer, Sushma Shrestha, and she really turned the entire scenario of singing in India. So I'm sure Dina is full of talents, and she's going to talk on very important topic, which I'm sure all of us are equally eager to listen. So we'll invite Dina. She has got a fantastic resume. Present designation is Senior Consultant Endocrinologist, achievements and awards multiple, immediate past President of SFA South Asia Federation of Endocrine Society, immediate past President of Dean Diabetes and Endocrine Association of Nepal, founder of DRRC Diabetes Rehabilitation Research Center, JCEM Editorial Board, the Journal of Clinical Endocrinology and Metabolism, member of ICSC Advocacy Working Group, Chief Editor for the National Consensus Statement of Type 2 Diabetes and Hypothyroidism. Present affiliation is Norwich International Hospital, Siddhi Polyclinic, Kathmandu, publication of National International Publication, many research interests, thyroid and diabetes in pregnancy. So we have such a star who's opening batsman. So over to you, Dina. Thank you so much.
Thank you so much for giving me this opportunity. And like you said, this is indeed an honor, and Dr. Anil and Dr. Malika, thank you so much for having me here. So today I think I would like to start with.
I think there is a confusion, Dina.
Yes, sir.
A lot of confusion. This is where we have to join. I think it is a Manilka, Dr. Boraskar sir, Amit, I had given you RX event. I think today you are not the official partner for this today meeting. It is Blue Tree, where already 383 doctors have already joined. So Dina and Dr. Boraskar sir, Amit and Dr. Manilka, I have shared you the new link. Please disconnect from this link and join on that link, please.
Okay.
Okay. Fine.
Because 383 doctors are already there. So
how do you just click on this?
Yes, please leave this link.
Okay, fine. Leave meeting.
Hello, everybody. I think there's a bit of a confusion, so I'm just holding on that if my chairpersons, Senior Dr. Anil Boraskar and Dr. Manilka are there with me. So I'm just going to wait for 30 more seconds till they join.
I just joined, so this is a new link. Is there any person from the organizers? Are we visible to the audience or are we online? Should we restart the... I think Dr. Boraska has not joined still.
Okay. Have I joined?
Yes, you're there.
Okay,
Yes.
fine.
Should we restart or
Yeah.
continue?
Start. Continue. Dina, you start.
Thank you so much. So thank you so much for being with me on this Saturday evening. I'm for sure this weekend, like Dr. Anil just told me that Saturday is a working day, and thank you for being here after your busy clinics. So today I think I like this topic. It's the way we've talked about GDM, thyroid in pregnancy. Diabetes is growing. Now we're talking about obesity, and also now, of course, the new elephant in the room, which we have to address, which we have been ignoring for quite some time, and it has grown in numbers and it has grown in size, is the mast cells, right? And especially after these last few months and years, it's almost more than a year, that is, the nomenclature has changed and the significance of the disease has changed in our diabetic patients. So we have to be more aware about what is happening and how it's taken a different turn, or how the new nomenclature has set a different route for its diagnosis, early detection, and how should we intervene. So my topic for today is early detection and early and intervention to improve the metabolic outcomes in mast cells. And this topic is quite dear to me, so I'm really glad to be talking on it. So really, what are the clinical implications for adults with pre-diabetes or diabetes itself with mast cells, right? So of course, the power is in the numbers. We know that whether it's diabetes, pre-diabetes, yesterday I was hearing a talk that how India is suffering because they have more pre-diabetics than the diabetics. So we are already overwhelmed by, we are already overwhelmed by these huge numbers of diabetes and its complications. And now we know that mast cell is there. So adults with pre-diabetes and type 2 diabetes have the highest risk of developing MASLD. No matter what you call it, fatty liver, NAFLD, and now MASLD, we know that every other patient that used to come to us, or every third patient, did have fatty liver, which is now turned MASLD, and we will discuss why the name is changed. So adults, I'm just going to move this a bit. So adults with pre-diabetes and type 2 diabetes, especially those with obesity, and we know obesity is a rising issue and it is the need of the hour that we have to address this too, should be risk stratified for having the MSLD and leading to obviously liver fibrosis. The way we worry about diabetes is because of its complications. We're also worried about mast cells because it is leading to liver fibrosis, of course, liver cancer. Increased risk of severe liver disease, MSLD with a significant fibrosis more than in the stage F2 raises the risk of cirrhosis, liver cancer, and overall liver-related mortality. And this has been the leading cause for liver transplantation. The red flag over here is that these patients are actually now going through a lot of liver transplants. And we know this is not easy, this is not cheap, this is not available to most of the people. And we know that if we can do something about it in the early stages, we should, because the complication is liver transplantation. Approximately 1 in 5 people with type 2 diabetes are actually now at risk of developing cirrhosis. So today, I think if these 20 minutes or 30 minutes don't...
Excuse me, Dina.
Yeah.
Excuse me. Sorry, I think the organizers are saying there is some confusion. We are not visible to our audience, doctors. We might have to restart. They
Okay.
have sent us fresh Zoom link to your WhatsApp.
Okay, sure.
Please check and shall we rejoin?
Yeah, I think so.
Sorry about it. Dr. Boraska, please see. I
Yeah.
think it's not visible. Only 3 of us are
We are visible.
to us, a few of us, but not to the larger audience.
Okay. So please join the meeting. Okay.
सर आपको मैंने एक नया लिंक भेजा है व्हाट्सएप पर, आप इसी लिंक पर लगे हुए अभी भी.
Yeah, I go on that.
So
Fine.
you please leave first this, na? You are not leaving this, so you will not able to join this.
Okay.
And Manilka, you have to leave also this link. And Nand Kishore and RX events today, you are not the official partner for this meeting.
Okay.
So it was your yesterday meeting. Sir, you have to leave and you close the meeting also. Okay, bye.